Ursula from Birth You Desire, and today we're going to talk about bottle feeding. Specifically, we're going to talk about a technique called paced bottle feeding. Paced bottle feeding is a very specific way of offering the baby the bottle in a way that allows them to stay in control. It also mimics the way they would be getting milk directly from the breast, preventing some gas, some reflux, and allowing the baby to control what their needs are. I have a Dr. Brown's bottle in my hand, and I have my little baby doll here who we're going to be demonstrating with. So when you get ready to do paced bottle feeding, you're going to sit your baby up in a more upright position. You're going to offer the bottle in a horizontal manner. You're going to bring it to the baby's mouth, and the baby is going to reach up and over and put the bottle in their mouth. Once the bottle is in their mouth, they're going to actually be taking in this much of the nipple. So their mouth is actually going to be flanged or open like a fish or like a bow. And it's going to be on this part of the nipple, not up here at the tip, down here at the mid to low base. So as you are giving the baby the bottle, you're going to hold it horizontally. You're going to allow the baby to nurse 20, 30 seconds. And as they start to slow down, you're going to leave the nipple in their mouth, but you're going to tilt the bottle down. In a few minutes or seconds, they're going to start to suck again, and you're going to tilt the bottle back up horizontally. When they slow, 30 seconds later, you're going to tilt the bottle down. A normal breastfed baby will typically do this whole process 14 to 21 times per feed, so be patient, tilt, and keep the nipple in their mouth and then tilt it back down. The time that the baby does not start sucking again is the time when they're over. And if there's a little bit of milk in that bottle, we want to just put it aside. We don't want to force the milk into the baby. We want to respect their boundaries and how full they are. The other thing we don't want to do is hold the baby, put in a backwards tilt, and put the bottle in at this angle. Basically what this does is it creates almost like a fire hose effect in their mouth, and many children will start to gasp or choke or take in a tremendous amount of air as they're trying to deal with that milk flow. So instead, think an upright position, latch the baby on the bottle, make sure they have a good seal around the middle to base, and give them the milk horizontally. You don't need to worry that the nipple is only going to be half or 3/4 full. The baby will take the milk as needed. Tilt down, but leave the nipple in. Tilt back up once they start to suck. Tilt down, and when they no longer start to suck, the feed is over. Congratulations.